Hi everyone, welcome back to the Vision Refocused channel where we discuss all things eye health and vision related. Today we're going to be talking about something near and dear to my heart, community health optometry. Let's dive right in. So first, let's talk about what is a community health center. A community health center is a nonprofit, multidisciplinary, outpatient medical facility. They're located all throughout the country and they primarily serve under and uninsured patients. This means health centers are caring for patients who often don't have access to go other places for their health care. Most community health centers provide medical, dental, and behavioral health services. Some health centers also provide other services such as OBGYN, chiropractor, and, of course, optometry. However, the vast majority of community health centers throughout the country do not include optometry services. So there's a really huge need for optometry services within health centers. Why? Well, these patients are not able to go elsewhere for their eye care, just like they're unable to go elsewhere for their medical care, whether it be because of their insurance, as many private offices don't accept Medicaid or are far too expensive for patients who don't have insurance to afford. Community health centers provide a sliding fee discount scale so patients who don't have insurance can actually pay based on their income. So it makes it affordable for them to receive the medical care that they need. We all know as optometrists and as optometry students specifically that receiving routine eye care helps prevent blindness. When conditions like glaucoma are caught early, they can be treated, whereas once vision has been lost, it cannot be regained. Community health centers also provide a variety of other services such as translational services, financial assistance, sometimes transportation. They really take care of the whole patient. It's been shown time and again that patients who go to community health centers for their medical care have a really difficult time going elsewhere for their eye care, which is why we need these services within community health centers. Whether for a seasoned optometrist or a new grad, a community health center is a great place to work. First, you're taking care of patients who really need your help. Second, you can do so and also make a successful living. Community health centers pay competitive salaries. You additionally qualify for public service loan forgiveness. Some health centers have Indian Health Service affiliations, which means that the optometrist also qualifies for Indian Health Service loan repayment programs. Because optometrists do not currently qualify for other federal loan repayment programs such as National Health Service Corps, some community health centers are also willing to create their own repayment programs for the optometrist. Many times people think that working in a community health center means that you're going to have to sacrifice your salary or basically kind of be like you're volunteering to do this type of work. That is not the case in community health centers. And you have a really great work-life balance, usually working from 8 to 5, Monday through Friday with an hour lunch, often no nights, no weekends, no call. Another thing I really love about working in a community health center is that I get to practice full scope optometry. As I said, I'm taking care of patients who oftentimes don't have other places to go to receive their care. I'm only referring patients who really need to be referred, which means I manage a lot of disease in-house. I feel every day like I get to use all the skills that I learned and trained really hard for during optometry school. And practicing in a community health center doesn't mean that you're going to be in some dingy old building with a dusty slit lamp in the corner of a room somewhere. Oftentimes, these health centers are building beautiful state-of-the-art facilities and creating a beautiful place for you to take care of your patients. Now, from the community health center perspective, why would they want to include optometry services? Why can't they just refer patients out? Well, many studies show that when patients are referred out, maybe half of them actually go to that referral. And in terms of receiving notes back to verify that that referral actually happened, far fewer. Which means having this service in-house allows the health center to track quality improvement metrics such as diabetic retinal screenings in-house, which can increase those numbers, and then increase GIPRA and HEDIS incentive programs. And of course, it increases revenue. Optometry services also get reimbursed with the same PPS rate for Medicare and Medicaid patients as other medical services within your health center. And of course, providing this service in-house means you are providing a necessary service to improve your patient's quality of life. Children who can see better can perform better in school. Adults who can see well can drive more safely and perform better in the workplace, and good vision helps prevent falls in the senior population. As I mentioned, most health centers across the country do not include optometry services. This means there is a huge need and a great opportunity for starting these services within the health centers. I've worked with several health centers to create optometry departments within their facilities. When you create the department, you also get to set the tone of the work culture and environment that you want to work in. You can create a welcoming space to care for your patients. We'll include several links below to webinars I've been faculty on, explaining the importance of eye health and vision services, as well as how to create these departments within community health centers, as well as some articles I've written step by step on how to create vision services within community health centers. I hope this video helps you understand the importance of eye care services within community health centers. As optometrists, we have the opportunity to care for the most vulnerable patients in our population and provide them excellent care. Working in a community health center allows you to do just that. I welcome your questions and comments below about working within a community health center. Thanks, and we'll see you in the next video.